Well, hello everybody. This is Dr. Carmen Bryant, and this is Car Chronicles. How are you guys doing? You doing all right? Well, all right. Let's talk about it. Let's do this. A lot of you have been in situations with narcissists, those that have narcissistic personality disorder. Now, keep in mind that everybody does not have the disorder, the mental disorder, the personality disorder. Some people have very strong narcissist traits. And so it may seem as if they have the disorder, but they have very strong narcissistic traits. They may go through all 9 of the different traits. Well, with a narcissist, normally they have 5 to 6 distinctive traits that are very, very distinctive. And no matter who they're with, no matter where they go, you can pick up on those traits. Once you know what they are, you can pick up on exactly what those traits are, and they're very distinctive and they don't change. That is exactly what they have. It doesn't matter who they're with. You can pick out those 5 to 6 distinctive traits. And Dr. Romney, who is also a professor, I think in California, according to the DSM, is 5 traits that will, or symptoms that actually determine whether a person has narcissistic personality disorder. And this is something that the professionals have to determine, not the common person, meaning that those of you that have just read on Google, or have read the book and you've determined that you know how to diagnose. No. It takes a mental health professional, a psychiatrist, a psychologist, a mental health professional that can diagnose. They do different intake assessments, and they determine that out of these 5, and Dr. Romney said usually 5 to 6, you can add 6 on there. But those people that have narcissistic personality disorder. Now, those of you that have been involved with these individuals, there is a fallout. There is a fallout. My phone's just going off, but there is a fallout. There is an effect. Those of you that have been in a situationship or relationship with a narcissist are affected psychologically and physiologically. And those of you that have been affected psychologically also may have trauma-related disorders, mental health disorders. And I'm going to talk about a few. So one of the ones that you're very familiar with is post-traumatic stress disorder. There's also one that's called acute stress disorder, and another one, complex post-traumatic stress disorder. Now, for most people who get out of these situationships with a narcissist or have been traumatized, assume that you immediately have post-traumatic stress disorder. You don't. That's something that usually happens within a 6-month period of time. Usually it's a 6-month period of time. Usually what you're having is acute stress disorder. Acute meaning right away stress disorder. Or acute stress. Let's put it acute stress. And acute stress may turn into acute stress disorder. But usually within a 6-month period of time, that's usually when you have post-traumatic stress disorder from maybe like a singular event. Those that have complex stress disorder or CPTSD usually have had trauma that keeps on happening. Those of you that are in a situation with a narcissist have trauma that keeps on happening, it just compiled on top of each other, which is usually people that are in situations of domestic violence, which is what narcissist abuse is, domestic violence, and you keep going through the trauma over and over again. That would be what you would consider complex post-traumatic stress disorder. There are some people that actually have complex post-traumatic stress disorder, PTSD, complex CPTSD, and sometimes they have been diagnosed with bipolar disorder. Bipolar disorder and borderline personality disorder, which personality disorder is also a trauma-related disorder, but borderline personality disorder and bipolar disorder can look very, very similar, but it takes a professional to be able to distinguish the difference between the two, because one is a mood disorder and the other one is a personality disorder. But a lot of times people have been diagnosed with bipolar disorder, and in actuality they actually have complex post-traumatic stress disorder. Another one is adjustment disorders. Some adjustment disorder, which is classified under like trauma-related disorder. You may have adjustment disorder with depressive symptoms, or adjustment disorder with anxiety and depressive and anxiety disorder. Well, adjustment disorder with depression and anxiety. symptoms. But that also can lead into post-traumatic stress disorder. You also have what's called reactive attachment disorder, which is found in children. And in children, a lot of times you find that in children that are in foster care, that move from foster care to foster care and cannot, they don't have attachment to a caregiver because they're moving from foster care to foster care to foster care. There's another one that's very similar to the reactive attachment disorder, which is called disinhibited social engagement disorder. That's what it is, disinhibited social engagement disorder. And this is what you'll find in children, where their behavior is like culturally illogical. It's socially illogical, meaning that they'll do things, and I was reading this, they'll do things like just I think it's stranger familiarity, or familiar social, or stranger familiarity. They'll do things like get in the car with a total stranger, or allow themselves to be taken. So that lets you know that there's a serious trauma related issue right there. They're trying to attach to someone, but they just have no social connection. They just get into the car with strangers. They allow themselves to be taken away, and it's almost like they want to attach to someone. Another, different types of depressive disorders, and some depressive, like major depressive disorder with psychotic episodes. So not all psychosis or psychotic episodes is schizophrenia. Some psychotic episodes also can manifest when major depression gets very severe and can go into psychotic episodes. Also, anxiety disorders. Anxiety disorders can be trauma related. Dissociative disorders. A lot of you are familiar with multiple personality disorders. Now they call dissociative disorder, dissociative identity disorder, and also personality disorder. Many of you are familiar with the personality disorder, and there are more than just cluster B personality disorder. You know, you do find that many people that have borderline personality disorder, a lot of that is manifesting from trauma. Of course, narcissistic personality disorder, you guys know that, and other disorder within the cluster B, the cluster B personality disorder. But there are other, cluster A, cluster B, cluster C. If you go look at different personality disorders. Also, substance abuse disorders. So many people that are addicted to, chemically dependent on drugs or alcohol, a lot of times that is their way of coping. So they become addicted to drugs and alcohol because they're self-medicating, and each one of the drugs are different. You talk to a chemical dependency counselor, they'll tell you the different types of drugs. You have uppers and downers. You have things like that white powder, methamphetamines, downers such as people take Xanax, they take, you guys know, fentanyl, things like that. But they have uppers, they have downers, they have different ones. I'm not sure if I'm supposed to say that on a social media setting, but you have uppers and downers, and different ones that cause you not to think, to go to sleep. Some people don't want to feel, some people don't want to think, so different ones do different things. And a lot of people are self-medicating, and their choice of drugs or alcohol, chemicals, usually depend on what they don't want to do. They don't want to feel, they don't want to think, they want, some of them cause them to hallucinate, some of them cause them not to be in reality, whatever it is. But a lot of times that's a sign of trauma, and they're self-medicating, to help themselves out. A lot of people that also have like ADHD or borderline, a lot of times, with a person that has a chemical imbalance, they take uppers because it brings them down, because downers bring them up. That's like with borderline, with bipolar disorder. And so I just wanted to bring that to you because there's also physiological effects of trauma, and we'll talk about that on another video. But there is a deep psychological effect when you stay in these situations with a narcissist. Your mental health is very important, and now it's time for us to seek mental health services. You need to get help. It's not an embarrassing thing. Don't let culture, a lot of times we have this cultural stigma about mental health, and men, you as well. Get yourself some therapy. Get yourself help.